hair fall, hair thinning, receding hairline. Almost every patient who walks into my clinic has this one question. Doctor, is there any treatment which actually works? Hi, this is Dr. Ravali Yalamanchili, Chief Dermatologist, Near Dermatology and Aesthetics. Today I'm going to talk about a treatment called as QR678 therapy for hair loss. Let us understand how it is different from a PRP, a growth factor concentrate therapy, and how it actually shows a major difference in hair fall. Hair growth depends upon healthy hair follicle, the blood supply to your hair, and also the good growth signals at the follicle level. In conditions like androgenetic alopecia or male pattern, female pattern hair loss and chronic telogen effluvium, there is a reduction in the growth phase of your hair cycle, and also your hair goes through a process called as miniaturization, where there is thinning of your hairs. So QR678 therapy is one of the best treatment options if you have these conditions, and let me explain you why. QR678 is a non-surgical hair growth therapy. It's a combination of growth factors and peptides which are injected into your scalp. This improves the hair quality, hair growth by working on your follicles, increasing the growth phase of your hair, and also by increasing the blood supply to your follicles. So the core concept when you start using a QR678 therapy for your hair loss is that it increases the blood supply to your hair, it improves the scalp environment, it improves the hair growth, hair density, and also the thickness of your hair follicles. So over a period of time, what people notice is that there's a reduction in their hair fall, there is improvement in their hair density, and overall thickness of your hair also is better. One of the most common questions most of my patients ask me is that how is it different from a PRP or a growth factor concentrate therapy? In PRP or GFC, we use patient's own blood and growth factors derived from that. So this can differ from person to person based on their existing conditions and also based on the patient's biology. QR678 is a pre-formulated standardized growth factor solution. It has a consistent composition and the treatment is targeted and specific for the person. There's no withdrawal of blood in this overall process. In simple terms, PRP is dependent on your body and QR678 is a scientifically designed formulation. The suitable candidates for this procedure are people who are noticing early changes of thinning, male and female pattern hair loss, and chronic telogen effluvium to reduce the hair fall. And someone who has a male or female pattern hair loss might benefit by adding minoxidil or finasteride along with this therapy. And you do not do this procedure for someone who have advanced stages of baldness or where their hair follicles are completely dormant or destroyed. The procedure is simple. It's an outpatient based procedure. It hardly takes around 15-20 minutes. You might need multiple sessions gapped between 3 to 4 weeks, and you might need anywhere between 5 to 6 sessions overall. The advantage of the procedure is that people who didn't respond very well to PRP or growth factor therapy might respond to this particular treatment because, like I said, the consistency of the solution or the composition is there, and you also have to combine it with the minoxidil and finasteride in case of androgenetic alopecia. Considering the factors that it is simple, it is painless, it's an outpatient-based clinic, it makes it one of the best procedures you can do for your hair loss. Yes, QR678 is a scientifically proven therapy to help revive and strengthen your hair, but key factors like patient selection, doctor's consultation, and proper protocols are necessary to have best results. If you like this video, share it with your friends and please subscribe to my channel. Anybody suffering with hair loss, if you want to know more about this treatment, comment QR678 below and we'll get back to you.